Hi, today we are going to learn about SUPAC guidelines. Here I am going to teach you about SUPAC guidelines in a short form to have an idea what actually it is. Okay, so before going to that, you need to know what do you mean by this SUPAC? SUPAC. What is that SUPAC? It stands for Scale Up and Post Approval Changes. So SUPAC means scale up and post approval changes. That's what it stands for. So what do you mean actually it is? It mean we have something approved here because you are going to scale it up. Again there are some points are going to change there. That change points need to be approved again. So initially you have approved something because you are going for the scale up, there are changes in that approvement, then you need to again register these changes. That what is your scale up and post approval changes. So we try to see what is this. Before going to this, we'll start with a story. Let's say there is a pharma company, and this company want to uh, sell a new drug. So it will go to the FDA if you want to sell that drug in US. If you want to sell that drug in India, it will go to CDSCO and it will register for new drug application. So a company want to register for the new drug. It will go to the FDA and it will register for new drug application. As a part of new drug application, the information which is been provided here is preclinical trial, preclinical trials, and safety and efficacy of the drug. So you need to provide preclinical trials data and safety and efficacy of the drug while going for the new drug application. So in this new drug application, along with this data, you will be providing what is the formulation, what is the composition of formulation. Why you are see you are applying a NDA application to conduct clinical trials in US because you want to sell the drug in US. You need to conduct clinical trials in US. So you are applying NDA application. You want to conduct clinical trials. So for that you need to provide what are the preclinical trials data, and also you need to provide what are the formulation which you are going to use for the clinical trials of that drug and what is its composition. You need to provide that because you are going to conduct a clinical trials there, and also what is the method of preparation of your formulation, etc. So complete data of your drug and its formulation which is taken for the clinical trials need to be provided in NDA application. So whatever you are providing here, they will approve this. Who will approve this? US FDA will approve your application. Whatever the data you are provided, they will approve this data. That what is in SUPAC we have approvals here. A is there, na? I will show you. Okay, yeah, this one. That A is approved. That what it post approval changes. So you are approved your formulation, your composition, method of preparation, etc. in a part of NDA application. It may be NDA for the new drug. For the old drug, it will be ANDA, abbreviated new drug application. So this has been approved here. Now, let's say he conduct clinical studies. After getting NDA application, after getting your NDA application, you will conduct clinical studies. Okay. So after conducting the clinical studies, let's say the clinical studies are successful. You have conducted clinical studies successfully. Now you want to go for the commercialization. So whatever the formulation you have approved here, see whatever the formulation we have here, approved formulation, we approved this, so that FDA has approved this formula, whatever the formulation is there. I am talking about formulation, we have many things to be related there. Whatever the formulation that is approved there, that formulation is for conducting clinical trials, and that formulation is developed in R&D. The scale of the formulation which is been used in the clinical trials, that is this one. Whatever the information we have provided in NDA application about the formulation, that scale is R&D scale formulation. Means in R&D scale you have formulated the drug and you are using the drug for the clinical studies. Now clinical studies are successful. Now you want to go for the commercialization. So you want to go for the commercialization of your product. So in the commercial product, see in the R&D you will be using only let's say 1000 tablets. You are producing only 1000 tablets. But in commercial scale, it will be millions and billions of tablets need to be produced here. Millions and billions of tablets need to be produced here. So obviously whatever the formula is there, that formula is suited for your R&D scale, that is 1000 tablets. Suddenly if you are going for the commercial scale, what happened? There are some problems which are going to be faced. That problems we call it as scale up problems, because you are scaling up from R&D to commercial. There will be some problem, we call them as scale up problems. To avoid this scale up problem, what do you mean that some problems, let's say example, in the R&D scale for mixing, you are mixing with the hands, but in commercial scale you will be using a large mixer, rapid, or you can using RMG, rapid mixing granulator, for granulation. In R&D scale you are granulating by hand. So there are some scale up problems which are going to occur in your formulation. There are some scale up problems which are going to occur in your formulation. Now to avoid these problems, because the machinery which you use for mixing, let's say take mixing as a scale up problem. In R&D scale it's a hand mixing, but in commercial scale it will be, you will be using larger equipments. So there will be a scale up problem which you are going to face. To avoid this, what will you do? You will conduct these studies directly. You are not going directly from R&D scale to commercial scale. Instead you are conducting pilot plant studies, so that you will be solving that scale up problems. So after conducting pilot plant study, now what happens? You found that there's something in the pilot plant study, you found that in the formula which is been approved by that is R&D formula which is approved in your NDA application, that is approved formula, because you are finding scale up problems in pilot plant study, you found that there should be a change in formula, because this formulation is not suitable in commercial scale as such, because it is R&D scale formula. By conducting pilot plant study, you found that okay, there should be some changes done. Now, but your R&D scale formula is already approved in NDA application. It is already approved in NDA application. Now you want to change this. Okay. Now what happens? Again you need to follow some rules to change, to implement that change. That rules are being set in guidelines called SUPAC guidelines. Now what is happening here? Now see, we can clearly see how that name scale up and post approval changes came. Because you are going to scale up the R&D formula, okay, which is approved in NDA application, if it is for new drug, which is approved, already approved formula in R&D scale, you are going to scale up. By conducting pilot plant study, you found that there should be some change should be made in the formula, because as such this formula of R&D scale cannot be directly transferred to the commercial scale. So through pilot plant you found that there should be some change in the formula, but this formula is approved in NDA. Now again you have to change. Why you are going to change? Because you are going to scale up. Hence the name is coined as scale up and post approval changes. For scale up, you found some problems in the formula which has been already approved. Post approved formula you need to change. Why you need to change that post approved formula? Because you are going for the commercialization, you are facing the scale up problems and you want to solve that scale up problems. For that reason you need to change the approved formula, post approved formula. So the name is termed as scale up and post approval changes. So that what is called as your SUPAC guidelines. So I am talking about some formula. It may be like let's say you are going for the change in method of preparation. Previously you prepared by direct compression, now you want to prepare by granulation, wet granulation. There also you need to go for the SUPAC guideline. You need to follow SUPAC guideline. Like this we have SUPAC guidelines for immediate release, sustained release and also semi-solid dosage forms. So to in short to say what is the SUPAC guideline says is, if at all you are changing, what is the level of change? First thing you need to keep in your mind is level of change. Level 1, level 2 and level 3. So 1, 2, 3 changes are depend on what is that impact of change is there on your safety and efficacy or safety and performance of the dosage form. Let's say I am changing some part in the formulation. The changed part is not affecting safety and performance. Safety and so it is not affecting safety and performance so much, hence we go for the level 1 change. That guideline says that type of change we call it as level 1 change. If the change is having moderate effect on safety and performance of the drug, in such case we call it as a level 2 change. If the same change which you are going to do in the formulation has major effect on the safety and performance of the formulation, we call it as level 3 change. So depending on the what is the effect on safety and performance, we are going to say whether it is that change is level 1 or level 3. Okay, so what type of changes you are going to do? It is been categorized in level 1, 2, 3. Then you need to conduct some studies to check whether that same let's say I have changed something in the formula. Now we are saying that that change has only minor effect on the safety, or you can say stability and performance of the formulation. We can add one word also here, stability and performance of the formulation. How do you come to know it has only level 1 effect on the formulation? For that you need to conduct some test. What are the tests you need to perform here is stability test, stability testing, and for performance you are going to test performance in the sense what, because it is immediate release or sustained release tablets, here the performance is dissolution. Performance test is dissolution. So for the test purpose you need to conduct stability and dissolution test for all the changes. See, if that drug is having less effect on stability and dissolution, we categorize it in level 1 change. If that particular change is having moderate effect on stability and dissolution of the dosage form, we call it as level 2 change. If the same thing has more effect on the dissolution, we call it as level 3 change. Okay, to know that change you need to perform the test. The test is stability test and dissolution test. Next, filing. Third point is filing. When you need to file, you may be filing annually filing. Every year you need to file the reports, report filing. What are the reports you got, how to file that and how to show that to US FDA. You need to file it annually. One type of filing is there. Other type of filing is pre-approved. You need to, if the change is major change, if you want to change any polymer in the dosage form, that polymer has more effect on the dissolution pattern of the dosage form, in such case you need to pre-approve that change and you need to file it. Okay, So this type of filings are there, pre-approved filing and filing annually. So we'll take one example here first. Okay, let's say I am producing some tablet in R&D scale. The formula is X1, X2 and X3 polymers I am using in R&D scale. Let's say that is this is 50 grams, 20 grams and this is 5 grams. 3 formulas, and we have drug also here. Okay, 3 excipients I am using in different formulation. This excipient is major, that is your polymer. Let's say X1 is polymer. So this is the formula for R&D scale tablet. Now I found that if I am going for scale up, I have got scale up problems, so I need to change the formula. So I will change the polymer concentration, or I will change the polymer itself here, anything. See, 3 type of changes are there regarding the polymer. 1, polymer's concentration can be changed. 2, change polymer itself, total polymer is changed, different polymer you can use. Or 3, different grade. You can have different grade polymers. If you are using MCC, the grade is pH 101 here in R&D. Maybe in a large scale you are using MCC grade pH 102. So the polymer is same, microcrystalline cellulose, but here grade is changing. That also you need to report, because the accepted or approved formulation is this one. This grade polymer is approved. Now you are changing to this grade, you need to follow that SUPAC guidelines. This particular change, how it is affecting level 1 affection, level 2 or level 3, and you need to test what are the tests to be done, then how to file them. Let's say I am changing grade here, same X1 I am using 50 mg, but here the grade is pH 102, previously I am using pH 101, and remaining everything is same. Okay, so grade change, it doesn't have major effect on the performance and stability. I found that it doesn't have major effect, so I am classifying it as level 2. If the polymer itself is changed, let's say in the second case the polymer itself is changed. Now what happens, instead of using MCC I am using HPMC polymer. So polymer is totally changed. In that case we consider that change as level 3, and I need to perform the test, that is dissolution and stability test. Everything is given in SUPAC guidelines, how to perform the dissolution also, and also I need to file pre-approved filing as well as annual filing I have to do for the level 3 change. So that what SUPAC guidelines, SUPAC guidelines is. So what you need to remember here is, I am taking the example of the formulation, but you can have, let's say if you are changing the equipment, then you need to follow SUPAC guidelines, because you are changing them. If you are changing the site of manufacturing, for that also you need to follow SUPAC guidelines. If you are changing the within the site, if you are changing the place of manufacturing, for that also you need to follow SUPAC guidelines. So anything change which has been already approved for the formulation, if you want to change it, you need to go for the SUPAC guidelines, and the guidelines is what is the level and follow the tests to be done and how to file them. That's all. I hope you understand.